So we're going to talk about pain relief for labour and birth, and this is things that are happening after you might have tried self-help pain relief, TENS machines, water and other things. So these are things that can be offered once you get to that established phase of labour, so around 3 or 4 centimetres. So the first thing that you might be offered is gas and air. Now gas and air is a handheld mouthpiece that you breathe in the gas and air through. Now this gives a relief for the time that you have it in your system. So as you've breathed in the gas and air, that will take effect, and the idea is that by the time that that contraction peaks, the gas and air is doing its job. Now for some people, they find that gas and air works great. Other people don't like the feeling it gives them, so it can make you feel a little bit sickly, a bit woozy, but it's a case of giving it a go, trying it out and kind of having a few goes at it and being guided in using it. So often it might be that you're not taking the breath in as it should be, or you're not taking enough of it in. So asking your midwife for some support with that is quite useful. Now it's given via a mouthpiece that looks similar to this, and this is a single use, so this is used for you and then nobody else. The idea is that you're going to take that breath in and start breathing in the gas and air as you start to feel your contraction is building, and the point of that is that when it reaches its peak, this is going to be in your system, giving you that distraction and taking the edge off that discomfort that you might be feeling. It can be used everywhere, so it can be used from a home birth to a birth centre, it can be used in a birthing pool, it can be used in a labour ward setting and a theatre setting. So it is a good all-rounder, and it doesn't have any effects on your baby during that labour process either. So that is something that you might come across as a first point of call for pain relief. It can be used against other things as well. The next thing that you might be offered is a opioid injection of pethidine or diamorphine. And for some people this works really well, and it gives them that time just to rest and for the labour to progress a little bit while they are a little bit more laid back and untense. But for some people this might make them feel a little bit out of control and a little bit sickly, a little bit drunk type feeling. Again, let it get into your system, and then once it's in your system, it's about working with it and resting. Some people manage to sleep, some people will just have to be able to sit up and have a chat and things, but the idea is it's just going to take the edge off things and make you feel a lot more relaxed. Now this can be given in a birth centre setting usually, and a labour ward, so it's something that is an all-rounder. And if you did still want to use the gas and air, you can do. Now with pethidine diamorphine, it is a known fact that it does cross through the blood barrier, so it does go through to your baby, and babies are sometimes a little bit sleepy or a little bit drowsy after birth. And again, that's not a negative. We are aware that this happens, but it is just something to be aware of, that is one of the kind of risks that you might get read to you. It has about a 3 to 4 shelf life of hours, and it means that once it's worn off, you can potentially go and then use a birthing pool or carry on being active and upright or whatever it is that you want to do. After that, some units, and this isn't everywhere, but some places will offer remifentanil as a pain relief option. And remifentanil is given as a patient-controlled drug. So it's given via a drip in your hand, and this is given always on a labour ward because it's going to be done by an anaesthetist, and it's going to be kind of monitored by obstetrics. So you're taking it up that level just for that extra care and support. And what happens is it's a handheld device, and when you feel any discomfort, you're in control of pressing the button on the machine, and that will send a boost of the pain relieving drug into your body and give you that relief when you need it. Now it is on a block, so you can't keep pressing it as many times as you want to. It will only release so much, and sometimes in mum it might kind of cause the breathing to slow and the heart rate to drop a little bit. So some people might be having to have monitoring on their oxygen levels and maybe some oxygen administered, and also babies will need to be monitored on this, so you will have the continuous monitoring going as well at the same time. So it's kind of an in-between space for an epidural or the pethidine diamorphine. You're in control of it. If you don't press the button, you don't get the drug, and that's kind of where it ends. The next one is the one that often is referred to as the epidural or the complete block. So with the epidural, that again is administered by an anaesthetist, and you will be in a theatre or a labour ward setting. So if it's being used for pain relief, it would be on a labour ward setting. If it was being used for anything else, it would probably be set up in a theatre. And when you're in the labour ward with an epidural, what this does is it gives you the complete block from waist downwards, and it enables you often to be able to rest, and again for your body to do what it needs to do in that time of resting. The difference with this is that you cannot obviously be active and mobile because you've got a complete numbness of your bottom half, so you can't stand up or feel that, and a catheter would be needed as well, just because you can't feel the urge to go to the toilet. Now, this has got benefits that obviously people can rest and they can kind of gather themselves a little while it's working. It can last as long as you need it, so it can be topped up in between as and when, and it can be kind of started to wean down near the pushing phase if you want it to be. Now, there is links to higher rates of assisted birth and caesarean birth with epidurals and spinals, and that's because obviously you've not got that feeling from down below. So if you can't feel anything going on, even though your body is going to push spontaneously, you can't feel to push against it. So it's going to be that guided pushing, which is why it increases the risk of kind of assisted birth and caesarean birth. But for some women, again, they will go through to have a normal vaginal delivery of their baby after having an epidural. And the last one is a spinal block. And a spinal block is not normally given as a pain relieving option. It's normally there for a planned caesarean birth where they know that that operation is going to take place within that 3-hour period. And it is sometimes used if there's a change in the labour. So if you're going to have an assisted birth, or you are going to go and kind of have some surgery afterwards, so manual removal of your placenta, or anything kind of a 4th or 3rd degree tear that requires stitching in theatre. If you've not already had an epidural in place, they will offer you the spinal, and then they'll do it with the spinal because it's less lasting. So after a couple of hours, it will start to wear off, and that's that. It's a one shot as opposed to an epidural, which is a continuous dripping of the drug going through. So I hope that gives you a bit of a clearer example of the pain relief options that are available for labour and birth. But please do pop it in the comments section if you've got any questions, or if you've had a baby, what worked for you, what kind of pain relief did you use. I always love kind of hearing real life stories of what worked for everybody differently.